Hello. Hey everyone. So, today I wanted to talk about Canadian healthcare because many people seem to not have any idea what it's about. What it's about, what's involved in it, how it works, you know? So I thought we'd talk about that. Now, many Americans and a few other non-North Americans seem to think that Canadian healthcare is free, which is not true. We don't necessarily pay for it out of pocket every single time we go to a doctor. And by necessarily, I mean sometimes we do. I'll get into that later. But yes, we pay for our healthcare through our taxes. I think you guys have taxes in the US, I'm not sure. But here we we have this thing called taxes where you pay the government money off your paycheck. It comes directly off your paycheck from your job. And a chunk of that goes to the government for various different things that you have absolutely no choice in, but you have to pay it. Otherwise, you just don't have a job. And then what are you gonna do? But anyhow, so that's how we pay for our healthcare, is through our taxes. And at the end of each fiscal year, which is March, April-ish, roughly, we have a yearly income tax that we need to do. We need to get this form, or it's usually electronic by now, and we fill in our past history for that year of our employment, what we made, net and gross. Yeah, there's a whole bunch of different sections, subsections of it. For most people, it's pretty straightforward because they don't have too much to claim. They ask you about how many children you have, your relationship status, blah blah, because they need to know everything about you for some reason. And yeah, this gets done every year. And that's how they keep track of your life and what you make, where you work, and it's how they've already billed you for that by that point, because it comes off your paycheck every time you get paid from your job. So you've already paid for your healthcare at that point. At that point, it's just whether or not you've paid too much and you get a return, or you've not paid enough, so you have to pay the government money, or you've broken even, so it's just you get nothing, but you don't have to pay anything either. It all depends. That is the first myth, that Canadian healthcare is free, because it is not. Oh yes, and when I said necessarily earlier, it was because quite a lot of our healthcare is not free, even if we rely on our tax dollars for it. We still have to pay out of pocket on top of that for a lot of our healthcare. Yeah, that's for like specialists, private healthcare, obviously. Surgeons, it depends what kind of surgery, because a lot aren't covered. There's a lot of like gray areas that are not included. You get billed for the ambulance ride if you need one, which I know is probably the same for America too, and other places outside North America. I just disagree with it. It's part of the whole healthcare experience. It should be included. But that's a whole other topic, because I don't think we should have to pay at all for healthcare. But that's another topic. So, la 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 la. There is oftentimes very terrible service when receiving any kind of healthcare. There are oftentimes good service too, but there's a lot of terrible service. And I mean, that could be said for any job, really. Like, you go anywhere and you could either get really good service, really bad service, neutral. But when you're talking about healthcare, you kind of want really good service, at least neutral service, so you're not being treated badly. But that's unfortunately not the case. Especially with old age homes, retirement homes, that kind of thing, there's a lot of abuse and neglect going on within those places. And it's not just recent, like the news, the media, mainstream media, wants you to believe. It has been going on for years, and people have been speaking up about it, and nothing gets done. It gets ignored, because the government just doesn't care. They don't care. Hospitals are also a breeding ground for bad stuff. I don't know really what you would call that. Viruses, bacteria, infections, whatever. And it makes sense too. You have a bunch of sick people in one place, you know, and a severe lack of staff in the industry, and overworked staff because of that. Yeah, like, that's gonna lead to problems. There's a major double standard for children too. If you come in to a place, a hospital, I guess a hospital would really be the only logical place you would, unless it's a walk-in clinic, that you'd be going for healthcare, but bringing a child. From my experience anyways, they are very quick to attend to you, and are very nice when you have a child with you. But that quickly shifts if you don't have a child. And it's funny, because the experiences I've had, it wasn't even clear that the child was the one needing help in the first place. And yet that's what they all assumed. So. Professionals in the healthcare field are also majorly uneducated, at least in the areas that I've experienced. And I don't say that disrespectfully at all. It's just what they've been taught. And some of them very much do not want to educate themselves. And when they are told something that they don't know about, they just kind of ignore it and pretend it's not there, or like they just kind of blow it off because they don't know what to say. I've experienced that with my family doctor, who does not have a clue about scoliosis. I try to inform her, talk to her, just conversationally talking to her, trying to educate her about it. And she doesn't have a clue. But she doesn't try to either. She doesn't want to understand. And she tries to tell me things that would help, or what the pain is like, or what my body is like. But the x-rays show differently, and I'm telling her differently, and she just doesn't care, because she doesn't know anything about it, and she doesn't want to know anything about it. Now, the actual professionals for people who need more of a professional than a general practitioner, they are very hard to find, and are costly, and have a long wait time. And it's not because they're seeing many different people, it's just because they don't want to see you. I was diagnosed with scoliosis when I was 13. We waited a year to get the surgery, to decide to get the surgery, because we were trying the Boston brace to see if we could make that work. It didn't work for me because I was too far gone. That was my decision, not the doctor's fault at all. But at 14, when I decided to get surgery, it took an entire year to get a surgery date. Like, it was booked. I had the date, but it was a year in advance. And I was a child. I was 14, with a major case of scoliosis. You'd think that would be a little bit important. Nope. By that point, I got much, much worse. I could have saved a lot of damage if I had had the surgery a year sooner, when I decided to have the surgery. And now that I'm an adult, I am trying to find another specialist to look into things as I'm progressively getting worse. My surgeon will not talk to me because I'm an adult now, and he is an adolescent surgeon. So, yeah, not much help. But there is no specialist for what I need in my province. None. I have scoliosis, so I would be looking for a scoliosis specialist, and at the very least, a spinal specialist. If I couldn't find a scoliosis specialist. But even that, there's none. They're taking new clients, new patients, or that are even willing to look at anyone. My family doctor contacted this one surgeon, who's a spinal surgeon. He got back to them saying essentially he was no longer taking new patients, so that was a dead end. And then they tried contacting this other guy. This is going back in January of this year. But he has not responded. And my family doctor told me that if they don't think something is surgery worthy, because they're surgeons, that they generally won't get back to you. Ever. They won't even look at your x-ray or have an appointment with you to say, what's up, or this is the condition you're in, or whatever. Nothing. And my family doctor, as I said, doesn't know anything and doesn't want to know anything. So I'm already trying to find a new family doctor, but again, nobody's taking new patients. And they're just going to be another family doctor. I need a specialist. So, what do you do? Free healthcare or not, when you don't have access to what you need? And the long wait times. The argument that they're long because they're helping people is so not true. Because those people that you think are getting help really are not. They're just being diagnosed with the easiest thing to diagnose with. And then being shoved off and told, here you go, with whatever prescription is made. And that may not even be what the problem is. And what they're given might be counteractive to what they need. But nobody cares, because they've been seen. And for the people that actually need help, the wait times are detrimental. As I said, I had to wait a year to get my surgery, which did much damage in that year that I was waiting. I was already far enough gone in the first place, which by my fault, I should have had surgery earlier. But waiting that year did make it much worse. And there are other people with much more serious issues that they need help faster. And it's not there. They don't get it in time, or it's just, oh boy. Yeah. And then mental health is a whole nother area of the healthcare. It is just not there. They like to put bandages on it or whatever and put up barriers and crap so they can't jump. That's not going to solve the issue. They're just going to find another way. The issue is that they need help, and they're not getting it. They need professional help, and they're not getting it. And they're not going to come to you and be like, I need help. Because most of the time, if they're at that point, they're not in the frame of mind to do that. They're either really fucked up and have an actual condition where they don't think there's anything wrong with them, or that they just can't get themselves to, or they're just not able to. Depression is, it's a tough one. There's very mild depression, where you can just ride it out and you get through it. And then there's the deep suicidal depression. And someone who is suicidal is not going to come to someone for help necessarily. They're going to hide off and hope that someone comes to them and cares enough to help them. And that doesn't happen. So yeah, that was enough of that. And off with the next one. See you later.